Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you for joining us today. Our guest in studio is returning guest, Mr. Scott Spackey, certified addiction treatment counselor and also the author of the book Project Addiction Counselor, How to Create and Sustain a Private Practice. And he's here with us in studio to discuss the need for private practice addiction recovery treatment, the patient benefits of such treatment, and the importance of healthcare providers understanding all the aspects of drug acquisition, both legal and illegal, and their use when choosing or implementing a treatment program. Welcome to Health Professional Radio today, Scott.
Thank you for inviting me back.
Thanks so much for returning. You know, as the author of Project Addiction Counselor, you are in private practice. Have you always been in private practice, or were you at one time connected to a treatment facility as an addiction counselor?
No, I did my intern hours at a facility, but beyond the intern hours, I've been in private practice since day one. I thought I would roll the dice and take a shot at it, thinking that worst case scenario, I would sign up and go to work hourly wage for a facility, and it went well, so I never had to. So I've been in private practice from day one.
And how long have you been in private practice?
About 13 years now.
13 years. So you would say that private practice therapy has been working for your clients, yeah?
Absolutely. I have a great reputation. As a matter of fact, I found out somewhat recently that a lot of my clients in the community that I was in were referring to me as the cavalry counselor, the guy you call to save the day when no one else was able to do it. So I was kind of pleased with that. I got a real kick out of that.
Let's talk briefly about maybe some attitudes and may possibly clear up some misconceptions. You are in private practice. Is that because and you did your internship in a facility? Is it because of inadequacies that you found within treatment facility, addiction treatment modalities, or is it that you can be a little bit more hands-on and maybe offer more customized or personalized treatment when it comes to addiction?
Actually, that is the motivation, because being able to customize and not have to conform to a corporate mentality, because once a corporation facility has a certain philosophy or mentality, they have to continue to be consistent with that message, and I respect that. But I need the versatility, because we never know who we're dealing with and what we're dealing with. So we need the versatility to be able to really change it up when we need to. Mm-hmm. And I need to be, and I've had to many times be very inventive, to say the least, creative, to say the least. I've come up with some techniques and some methods on the cuff, off the cuff, in the moment, that most people, when they hear about it, they're thinking, how did you do that? How did you come up? You're in that moment and you need to save somebody's life. So a little bit of both. I was a little bit frustrated with what was going on out there, and I don't conform well. I never have. Hence my past with the drugs and all that. I don't conform very well, and so I absolutely need to kind of do my own thing and lead my own way. And as long as it's working, then I think that's a safe thing to do.
Now, you mentioned in Project Addiction that you've been clean for, more than 20 years, with the exception of a few, as you call them, harrowing relapse experimentations. What exactly does that mean?
Well, that's an awkward question. That means that, as I point out in Project Addiction, I broke with sobriety to experiment with a few things to be able to write firsthand, visceral, actual accounts of those drugs. It was risky. It was dangerous, and I don't recommend it. Okay. However, as it explains in the book, there was a lot of thought, planning, and preparation and support that went into that. There's a lot that goes into that. So it's not like I just went out recklessly and just had an episode. Nothing like that. It was very calculated, and again, even as calculated as it was, I never for a moment considered that I was safe and wasn't at risk. It's something that I was willing to do for that project so that I could help the people that I was helping. One of the greatest responses that I've had as a counselor is that so many people that I've helped over the years resonate with me because they know I'm the real deal, that I actually stuck a needle in my arm, that I'm not basing everything on theory. And so I was always able to get addicts to listen to me when most people couldn't, because they knew I walked the walk and talked the talk, both. And so I was willing to put a lot at risk to be able to sacrifice to make this project all-encompassing, everything that it was. And I did take that risk, and it was risky. And I don't regret it, but I wouldn't do it again. I did it that time. I did it for that book, and it's done.
What would you say to the physician or the counselor who's employed at a treatment center, or maybe just a part of a treatment center, volunteering, who knows? But what would you say to them when it comes to the importance of them understanding the acquisition and the actual use of these drugs when they're trying to help someone? I mean, you're just trying to get the person off drugs. Is it really that important to understand how this person is going to acquire those drugs and possibly use those drugs in order to be able to help that particular person?
I think the more we know about a person and the details, and I mean specific details about the drug, the method, the acquirement, what it feels like, their motivation, personal, mental, emotional, spiritual, all of the above, all of that can come to play in a significant way to treat someone. Again, we cannot apply some type of generic mentality towards someone. It has to be customized and specific to them, who they are, what they're doing. And the less we know about it, the more ignorant we are, the less we can help them. Eventually they're going to look at us and think to themselves, okay, this is all valid and good, but you don't really know what I'm talking about. Kind of like if a woman who has given birth starts to explain to me in detail what it's like to give birth, and I look at her and say, oh, yeah, I get it. No, I don't. No, matter how well you describe it, I absolutely can't. So, again, at the very least, we got to do our research. We got to talk to people and really get that very wide spectrum of experience so we can know what we're talking about. This is something that is so sensitive, so delicate, so dangerous of a treatment that people die if they don't get treated with this properly. And so a lot is at risk. So we need to take the time to really research it and know it well. And sometimes shrug our shoulders and look somebody straight in the eye and say, you know what, I don't have any experience with that. But, and what I usually follow that with to a person is, but I know about this, and we start sharing some stories. We find the common ground. We bond over those things.
When you're talking with someone and you see that this is going to be a really, really tough, I guess, nut to crack, for lack of a better term, what do you say when you're talking with other providers, healthcare providers, about their tough cookies? Do you talk about what is the toughest personality to help, or is it more what's the toughest drug, or does it depend on the person?
It definitely depends on the person. I would say that, honestly, a drug is an inanimate, unconscious thing. A person is a complex thing. And so it's definitely more about the person than it is the drug itself. I don't care what drug it is. I have a formula for each and every drug and behavior that's out there. But the people, you better adapt quick, because eventually you're going to meet people every once in a while, sometimes once a week, that defy all the things that you thought you knew about people to begin with. And for example, recently, I picked up my phone when I was taking a walk, and I saw a weird number, and I answered it. It was a guy from the UK who found my audiobook, and he found a way to get in touch with me, and he was asking me to please help him, if he could hire me as his counselor. And I took that job on. And it's one of those cases where you were just kind of pointing out. For the first couple of weeks, I'm thinking to myself, this is really frustrating. This is, as you said, tough nut to crack. This guy is just nothing but problematic. He's taking a lot of time. It's frustrating. I'm a professional, but of course I'm a human being too. So it's tiring. Well, what can I tell you? About 10 days ago, we made a major breakthrough. And I can tell you this with absolute confidence. It is unlikely he will ever do drugs again, and very likely that if he ever does, it'll be a very brief relapse episode, and that's about it. The breakthrough has occurred. And so what I would tell people that are confronted with some of those things is, it's rather generic, don't give up, is our job. We have a responsibility as the sober guiding force to these fragile people who are desperate and need to be saved from themselves. We have a responsibility to be innovative, to be variable in our thinking, and we have to continuously adapt and find new ways to think and approach.
You are the author of Project Addiction Counselor, not Project Cocaine Counselor or Project Alcohol Counselor. You specialize in addiction. Do you treat other issues, not only substance abuse?
There's as a matter of fact, the last section, a big last section of the book in Project Addiction is behavioral addictions. And we're not talking just about gambling, because that's the most common one, but I deal with shopping, sex, relationships. There's what I call parentaholics. I've treated a lot of parentaholics, people that are not good parents as they could be because they're overdoing it and they don't know the boundaries. And so, and it works on, and it functions on the same principle as an addiction does. And so behavioral addictions stimulate the exact same neurotransmitters as a drug does: dopamine, norepinephrine, serotonin, etc. And so they need to be treated in similar ways, but they need to be customized. So absolutely across the board. And again, they have to be treated very differently.
And tell our listeners where they can get a copy of Project Addiction Counselor, How to Create and Sustain a Private Practice.
All of my books, Project Addiction and Project Addiction Counselor and a Stones for my memoir, are available. You can first go to the website, projectaddiction.com. There's also a projectaddictioncounselor.com and also a stones-throw.com. But Amazon, Barnes & Noble, BookBaby, anywhere that you buy your audio, your ebooks, or your print books, anywhere that you buy a book, you type in my name or Project Addiction, it'll come up.
Scott Spackey, certified addiction treatment counselor, and also the author of the book Project Addiction Counselor, How to Create and Sustain a Private Practice. Transcripts and audio of this program are available at hpr.fm, and you can subscribe to this podcast on iTunes.